Welcome to the Mayo Clinic Cardiovascular Continuing Medical Education Podcast. In collaboration with an educational content partner, National Dairy Council, a nonprofit dairy nutrition research and education organization that shares science-based information on dairy's nutritional benefits for health and wellness. Join us for this 3-part mini-series to discuss nutrition and cardiology and gain valuable insights that can be directly applied to your practice. Please visit usdairy.com/National Dairy Council for educational content relevant to the podcast series.
Hey everyone, my name is Kyla Lara-Breitinger. I'm a preventive cardiologist here at the Mayo Clinic in Rochester, Minnesota. I'm also the co-director of our cardiometabolic clinic with a passion in nutrition. So I'm very excited about the 3rd episode of our 3-episode series with the title for today's podcast on myth busting, common misconceptions about dairy and heart health, personalized nutrition in dairy, and practical tips for heart-healthy dairy consumption. And it is my absolute pleasure to introduce 2 colleagues and friends who are very much front and center at Mayo Clinic when it comes to heart health and diet. We have our lead dietitian, Tara Schmidt, who is an instructor of nutrition at the Mayo Clinic. She's also the lead dietitian for the Mayo Clinic Diet, host of the podcast Mayo Clinic on Nutrition, medical editor of Nutrition and Fitness Channel, and co-authored the Mayo Clinic Diet Weight Loss Medications edition. She's passionate about reducing weight bias and educating people about realistic, evidence-based weight management. Thank you, Tara, for being here.
Thanks for having me.
We also have the wonderful executive chef Jen, who received her culinary arts degree from the Johnson & Wales University in Providence, Rhode Island. She's held positions at the Hyatt Hotel in Newport, Rhode Island, and at Hilton Head Health, where she strived for the very goal she strives for still today at the Mayo Clinic Abraham Healthy Living Program here at Rochester. She is also, if you haven't picked it up, the author of the Cook Smart, Eat Well cookbook. Hello, Chef Jen.
Hi, thanks for having me.
Oh, it's so great to the 3 of us to be together in the same podcast. Or even in the same meeting. So it's wonderful to see you both. I'm just going to go ahead and give an outline of what I hope intends to be a very lively discussion between the 3 of us and just learning so much from you both. We're hoping to really understand encouraging full-fat dairy to avoiding dairy at all costs, which is the right way to go. You know, we know that the internet has a wide range of opinions and advice, expert and otherwise. And do the nutritional benefits really outweigh the risks? Are there populations of people who should avoid it? I'm really hoping we could dig into some of the research around dairy and associated health outcomes and ways to healthfully incorporate it into one's daily intake as well. But also best ways, and more importantly, maybe the viewers will want to know easy ways to incorporate dairy, maybe sneak it into some recipes, different types of cheeses to use in recipes that help with flavor, that can prevent you also from over consuming, and some best post-workout dairy eats. How does that all sound?
Works for me.
I'm pumped.
All right. And so let's just start. Does anyone want to say anything off the bat about dairy and heart health in general, or how you both feel about dairy and incorporating it into your own diets or with the patients that you see?
If we can, I'd love to hear your knowledge. You're so much more of a researcher than I am. But talk about this relationship that we have between LDL and saturated fat, which I feel like we know has a fairly well-researched background. Increased intake in saturated fat raises LDL. But is dairy the outlier, right? And so we used to be really cautious in the world of dietetics about limiting people's saturated fat intake. We can say 7%, we can say 10%, depending on what guideline you're looking at. But is that all saturated fat? So I would love to bring up some of the more recent kind of meta-analyses or reviews that I believe have kind of said, okay, we still need to be mindful about cholesterol, LDL, but more so encouraging a healthful pattern of eating, right? Is red meat, is coconut oil, is ultra processed foods high in saturated fat, is dairy all the same when it comes to risk? Do I get to flip this and ask the host the questions, right?
I guess we're
Now
doing
you're being
it.
interviewed.
And I'm happy to, because I think this is the confusion that people have out
Mhm.
there. Obviously, the data is very robust with the saturated fat being associated with LDL cholesterol, that if you raise one, you'll raise the other.
Mhm.
But I think what's really important to know is that isolating a food product as the sole cause of poor health is probably not the ideal way. And I totally agree with you, where patterns are more important. And so when it comes to, let's say, coconut oil, which is purely saturated fat, and we can see the data that shows people who are coconut oil consumers have a significant raise in their LDL cholesterol. And when they stop taking in that as their cooking oil or form of cooking, the LDL comes down. I
Mhm.
think when it comes to dairy, the data still remains unclear. There's certainly some retrospective studies, right? And all of this comes from observational studies where they're able to pull out from, let's say, food frequency questionnaires, just dairy, and they can make some associations. But really, there's really limited data on randomized clinical trials, really focusing on dairy and whether or not it's beneficial or not. And so I think there are a handful of studies, a couple I'll point out, like the Pure study that really showed no association with reduced mortality and actually lowered the risk of these composite outcomes for stroke and overall mortality. And there's also a French prospective cohort study that they're following over decades that show, we know the French, they definitely enjoy full fat dairy. I've tried to order a soy milk latte in France, and the person
Did they
just
look
stared
at you
back
like
at
you
me.
were
Oh, yeah, it was like totally
sinning?
insulting. Like, do not come here and ask us for a non-dairy product with your, you know, cappuccino or your like cafecito. That's a different country. But and so, interestingly enough, like they put out data also, their prospective cohort, it's like the Nutri-Sante study, that they show that full fat fermented dairy and cheeses really had no association with worse cardiovascular outcomes as part of the dietary pattern of the French diet. And so, when you isolate these different dairy products, full fat versus non fat, they're really finding that some of the data shows it's protective, some it's neutral, and some is controversial in terms of it being associated with harm. Would love to get both of your input on what you think about that.
And I think all three of us, when we see patients and members in our day-to-day job, we never talk to them about singular food groups or singular foods or singular nutrients. There's no way that Chef Jen is going to have a cooking class and just ask someone simply about what they cook in this very, very small category. You, Dr. Lara-Breitinger, when you talk to your patients, I'm assuming you talk about the pattern. So I ask so many more questions. I ask about their fruit and vegetable intake. I ask about their grain intake, how often they're cooking with what type of oil. And if I'm going to make chocolate chip cookies, I'm going to make them with butter, and you're not going to
Yeah.
change my mind. They're very good, by the way. So I think that it's so much more important for, just going to call out the internet and maybe TikTok a little bit, to remind
Mhm.
people that we don't eat or live in vacuums. We also have a really difficult time studying nutrition in the first place because we can't lock people in rooms and then ask how their food
Exactly.
is to see how their nutrition impacted it. So, what are you eating habitually? How often are you having these foods? What types of synergies do the foods you eat have together? And Chef Jen gets to talk about kind of the fun part, which is like, what do you do in your kitchen? What does that look like? What do you have in your pantry?
Yeah, I couldn't agree more with that. And so, you, Tara, as a dietitian who sees these patients pretty regularly, can you tell us some of the nutritional benefits of dairy? Dairy gets this bad rap about having the full fat, saturated fat, et cetera. But maybe talk a little bit about the nutrients that, if you replace sodas, kind of sugary drinks with a dairy that might be full fat, but there are other things, including like the milk matrix with other nutrients that can be very beneficial and a replacement for these more ultra processed, high fructose corn syrup types of drinks.
Yeah, you brought up a really good point. A common question that I have when people bring up quote unquote controversial foods is what would you be having instead? So if you choose to eliminate X, Y, or Z, what is going to be your alternative? And we know, of course, that some people actually make a worse choice nutrition wise
Right.
or nutrient density wise or calorie density wise when they make those substitutions. So the benefits that we know about dairy, which you can get from other food groups, should you need to, of course. I think of the DASH diet, right? So I think about calcium and potassium, phosphorus, protein, vitamin A, vitamin D, vitamin B12. So there's a lot of good stuff going on here. So if you need to get it from other food sources, we can help you do that. But that was a pretty long list of beneficial nutrients. And so, like you said, when we are talking about someone's dietary pattern, we want to make sure to hear about where they're getting those nutrients. And if their diet happens to be low in dairy for whatever reason, where do they plan on getting them? Or if they're going to switch to a more plant-based milk beverage, I don't know what we're supposed to call those anymore. Are they going to get the same nutrient profile?
Absolutely. And maybe Chef Jen, you can help us understand a little bit about, full fat dairy and satiation. Do people consume less calories if they're having full fat types of foods such as dairy? And how to actually incorporate that in a way that maybe someone doesn't imagine maybe now just chugging a glass of milk like we did in our childhood with our, mealtime dish, but maybe other ways in which we can incorporate that. Do you have any thoughts about feeling full when you have dairy versus other kind of sugary drinks that raise your glycemic index and then you crash and then you want more?
Absolutely. And I am also going to put this out there that I am a dairy farmer's granddaughter. So I grew up on a dairy farm. So I grew up on
Did you
whole
milk the cows too? I was going to say, did you drink out of the tank?
short for that. But I did grow up on whole milk, like right out of the bulk tank. Like, so I grew up with that very much so. And I think that people do tend, and it's hard because we're in a society where we're not always paying full attention when we're eating, right? Um, but it does seem that when people are consuming some full fat products, they tend to be satisfied with a little bit less, which I don't know if it's necessarily just like the density of it and just a little bit heavier. So the way maybe it coats the stomach, but it does seem that that seems to be kind of like the overall, if you're making like a full fat smoothie in the morning with Greek yogurt, so that could be a mixture of the higher protein content, but it could also be a mixture of the higher fat content as well. Some cool things to do too is when you're using those types of things, I highly recommend if you're going to use a full fat dairy like yogurt, put that in your muffins instead of butter or like your canola oil, because it is going to offer three things actually. It is going to be your fat, so that's mouthfeel. The second thing is to be protein, so it's up protein in your muffin. Also, it's going to help moisture, so to keep your muffins actually moist versus using things like applesauce and fruit purees that tend to just be like sugar and don't keep that moisture very long.
And I love that you talked about protein because I think the era of these transformational anti-obesity medications with drastic weight loss, the biggest criticism is how are we going to maintain adequate protein intake? And dairy, while it has fat, also contains protein. And so this could be a really wonderful kind of easy way to get in your protein with somebody who might not want to have a bunch of volume in food because they're already being reduced based on the way the medication works, these GLP-1 receptor agonists. So I think that's absolutely fantastic. What do you guys think about the role of milk alternatives, though, in replacement? What is everyone's vibe about that? I know, there's every nut milk available, and people prefer different ones. And different coffee shops have the oat milk versus have the soy milk, macadamia nut milk. Are these empty calories? Do we get enough protein? I mean, they're much lower in the saturated fat, but are we getting the same value? And have these even been studied in a randomized kind of prospective way?
Yeah, I'd love Chef Jen to talk about substituting them because not every substitution always turns out as you'd like to. From a nutritional standpoint, what I think most dietitians would say is that soy is going to be our closest to cow's milk. So if you have an allergy or whatever reason that you'd like to avoid cow's milk, soy is going to be your closest bet because, especially from a protein standpoint, those are equivalent. But even in the 2020 to 2025 dietary guidelines for America, and they put milk in quotes, made from plants, almond, rice, coconut, oat, hemp. I had quinoa milk once. It was not very
Ooh,
good.
what color is it? White?
I think it was like creamy or cashewy looking. I don't know. I don't think I paid very much attention to it. Now, they're all fortified differently, right? So these may have
Right.
calcium, but they do not have the equivalent of protein. So that would be the biggest kind of coaching factor I have for my patient of if you're going to replace dairy with a plant-based milk product, soy is going to be your closest bet in terms of calcium, vitamin A, vitamin D. They typically fortify it with B12, which is great for our vegetarian and vegan populations out there. But we also have to be careful of added sugar. And I will shout it from the rooftops that cow's milk does not have added sugar, as crazy as the internet tends to go. But a lot of these plant milks do. So I like to look for unsweetened or look at that label and make sure that the added sugar row says 0, because that would also be the true of white cow's milk.
And I think it's also important to like, what is your why? Like, what is your why for not having cow's milk? I've heard a couple of different arguments of like, we're the only mammal that still drinks milk. And I would say we're also the only mammal that uses cell phones and drives cars.
That's what I'd say.
So I think if we also recognize what is our why, right? And we always, and part of my consultations with patients as well is like, if we're eating and drinking foods in their wholest, purest form, like that's what's going to feed our body the best. But obviously, if you have an intolerance and you need to substitute, yeah, I would say definitely like an unsweetened soy milk usually does substitute fairly well. I will say that there are other like milks and creams, if you're trying to be vegan, that are like maybe like a coconut milk that can at least it replicates the mouthfeel. So when you're looking for that and you can't have dairy, it's so funny. It's called like country. I think it's called country crock, and you'd think it meant like right away margarine, but it's actually a vegetarian or vegan like heavy cream. And so it does. So for your coffee, a small amount, a little goes a long way. Right, still going to be high in fat, but that would be something it's real, and there's not a lot of ingredients on that either, or sweet.
Yeah, and that's something that, two things that are running in my mind now is the idea of the high sugar content or potentially high sugar content in some of these milk alternatives. And one question I have for the group is, sugar and these very high carb diets are being more and more focused on to be linked to pro-inflammation. And we know the systemic inflammation has a huge impact on the atherosclerosis pathway or building kind of, fatty plaques in our arteries and also being somewhat linked to some food related cancers as well. And so interesting that we think about milk alternatives, we think about sugar. And then we notice that with dairy, as Tara mentioned, that, there is no added sugar in that. And so is there, from what you both know or what you think your opinion is, consuming dairy pro-inflammatory? Is it anti-inflammatory? What is your take on that?
I hear this a lot from my patients, and we have a lot of people who come in to the clinic, understandably looking for a quote anti-inflammatory diet, right? And a lot of times they will list things assuming that gluten and or dairy are the culprits. And I like to politely educate them that if they don't have an intolerance or an allergy to those things, they're likely perfectly fine to have. There's a lot of benefits to whole grains. I don't really care what grain it is. Like we said, there are nutritional benefits to dairy. Should you tolerate it? Should you not be allergic? Of course. I think what I like to educate people more so on related to inflammation is, yes, saturated fat may increase inflammation. But again, let's look at your whole diet. Let's look at the red meat in your diet. Let's look at any food that you have that has trans fat, even in small amounts in it. Let's look at how many ultra processed foods you have in your diet. So instead of kind of immediately attacking, again, a singular food group, I would rather listen about the other foods I'm probably going to be a little bit more strict on before I go to dairy. One, because we have a lot of nutritional benefit to dairy, but also because I want to talk about fruits and vegetables. And what if it is fermented dairy? Okay, then I think we can go in the opposite direction and talk about the benefits of fermented food. So I'll be neutral. I will talk to you about whatever you enjoy eating, but I like to make that a much wider lens, let's say.
I love that you said that, Tara, because I literally had a patient today that it was an inflammation thing. And it was so fascinating because what he really needed to take out of his diet, he did eventually, but he also took out dairy. But the biggest thing was alcohol. But he kind of demonized dairy along with that. And I said, well, I think you actually took out the main thing that is actually the culprit. I said, but I was like, dairy really does have, and it was just fascinating because you just brought that very point up, but he was still unsure. I said, I
Mhm.
think in, frequency and consistency, and that's what you're looking at and the quantity, right? But I think little things of cottage cheese, little things of yogurt, those have some really big benefits.
And there's always a substitution, right? So I would prefer that people, when able, cook with olive oil,
Mhm.
but that doesn't mean that you can't have a Greek yogurt at the same time. So we're not really pushing for one or the other. I just want you to figure out a pattern that gets you the right nutrients, that gets you beneficial food, that you actually like eating so that you're not miserable. And all of us can be friends, right? Like it can all exist in the same diet, but I feel like our population really loves to polarize things.
Oh,
Do you feel like that? Or is that just me and like my high blood pressure related to the internet?
no. I totally agree with that. And I think, importantly, people who are science driven, when we think about pro inflammatory things, we think about the inflammatory biomarkers that are easily tested. And I think even the literature looking at fermented dairy products, cheese, and even milk
Hmm.
dairy, depending on the population, it's either neutral or it's in favor of dairy, especially in patients who have metabolic syndrome, because metabolic syndrome, having just excess sugar, is pro inflammation. And maybe dairy has some role we don't understand yet that somehow neutralizes that, where they've seen reduction in biomarkers. But then in other studies, they found that there's no difference between people who have dairy versus not. And there's no changes or differences between things like high sensitivity CRPs, some of the ILs, and TNF alpha, and different biomarkers like that that have been established to be associated with inflammation. And so I think that is kind of still in the air. And I know we're in this era where most people are in search for longevity and anti inflammation. So kind of stuff that we always have to be thinking about and talking about when it comes to pro versus anti-inflammatory disease. And I totally agree that depending on what else you have in your diet, and let's say, right, somebody has a clean diet, right, and the only thing that you can identify as having high in saturated fat is dairy, but they otherwise eat relatively, vegetarian with plant-based proteins, or like fatty fish with your poly and monounsaturated fats, and everything else, nothing is fried, everything is cooked in olive oil, maybe the dairy, and then the LDL cholesterol is still high. Then there's an argument there for maybe let's reduce the amount
I
of
agree.
cheese maybe, or the amount of butter you're putting. I'm not a component of butter. It's very high in saturated fat. That's one thing I think that the data is pretty clear on. And then seeing if that has an effect, right, on your lipid panel in 3 to 6 months. And I think me being a preventive cardiologist, I do believe in the science that the lower the LDL cholesterol, the better. One of my former mentors who's at Mount Sinai, Dr. Valentin Fuster, he's actually doing a study on people who are 30 to 40 years old. It's called the pre-CAD trial. And he's actually, without any risk factors, they're 30 to 40 years old. And his goal is to keep their LDL less than 70. Okay. And we'll follow up with them in 4 to 5 years. And if their LDL is greater than 70, no history or family history of coronary disease, if their LDL is greater than 70, he's going to give them inclisiran, which is an injectable form of, cholesterol lowering to keep it that, because he has data that shows anytime your LDL cholesterol is greater than 70, you start to build plaque in your leg arteries and even in your carotids or your neck arteries. So when I think about the different foods that contribute, I always try to look for the ultra processed kind of saturated fats first, which most Americans With the exception of your superstar patients, those are the lowest hanging fruit rather than
Mhm.
finding a farmer who grew up eating red meat and maybe they eat lean red meat, right? But then they have ultra processed foods or anything. I'm not going to tell them stop eating the red meat when that, in comparison to other really negative foods, I will focus on those things. I don't know how you both feel about that when you're consulting with patients.
Yeah, I like to remind people too that we have a good amount of research about patterns of eating that are beneficial, and even in multiple studies, and they have multiple titles. So let's talk about the DASH diet and the MIND diet and the Mediterranean, which make up that one in the middle. But what's part of all of them, which is fruits, vegetables, unsaturated fats, beans, legumes, whole grains,
Mhm.
sometimes fatty fish, or at least lean proteins. So, if we can focus on increasing the foods that have been promoted across these very, very kind of medically backed diets, let's focus on that. We clearly know that if we have 3 or more different styles of eating that have been not only shown to decrease inflammation, decrease blood pressure, cholesterol, etc., let's focus on what we know, and then the rest we can kind of fill in with what you prefer. I think Jen does a really good job of helping people stay with a diet that is nostalgic or culturally appropriate to them, but to also tweak it in the right way to move it in a healthier direction. Do you do that with cooking technique most often or portion size?
Yeah, so like this is the best way since we do have a lot of people from the Midwest and red meat is very common. I usually say, okay, let's say you're having lasagna, you're having Swedish meatballs or something of that nature. I'm going to ask you, would you throw some quinoa in there instead of crackers? Because the quinoa, I'm going to get some protein. So my ratio of red meat is now going to be lower, but my portion is going to be the same size. Right. So I'm
Mhm.
not taking away their red meat. I'm just finding ways to make it better so we can kind of stretch this along. And for some of them, I don't even know like if they're making that stuff at home, I'm like, okay, so either you have a French background cook at home, or is it okay? Maybe I'm not doing very well in other areas. Maybe we just polish what we're doing at home a little bit better, and maybe let's focus on maybe you're getting some fast food. Okay, wait, can we take that out? Like let's look at the real problem child and see how we can make that better versus be like, well, you got to take all the red meat away, you got to do all of that because they'll never stick to it, and you'll lose them, and we don't want to lose them.
Yeah. How
Um,
often, right? Like,
yeah.
while we're recording this, the holidays are almost here, and everyone always wants me to healthify their holiday recipes. And that's fine if you'd like to do that. But I will typically ask, like, how often do you have that dish? If you have that dish once a year, just make it how your grandma made it. It's okay.
I mean, it's so important to talk about this, because food culture is probably front and center in most cultures, like globally. And so the more you restrict, while there are certainly so many benefits with restriction and really limiting, many of the things that are culturally normal that might not be the healthiest. It just depends on the frequency in which you're having it and how much of it you're having it. So I really love that, especially, knowing that, as you said, Tara, the holidays are coming up. Just for instance, my husband made turkey chili. And normally, what you eat with turkey chili is like some cheese on top, and the other garnish is usually sour cream. So we replace the sour cream with a full fat, non flavored Greek yogurt. So it still has that consistency and the contrast with the hot chili, especially if it's a little spicy. But now I'm getting even more protein because I'm having Greek yogurt with the turkey chili, which has a ton of protein and beans and legumes, etc. And so I just think it's so wonderful. And I think at this point we got to pivot. And Chef Jen, you got to tell us all the secrets and most of the dishes that we make or snacks, and how do we incorporate ways to eat less eat less, portions of food while still feeling satiated. Because as you said, the diet that works for the patient that they'll stick with is the correct diet for that patient, knowing that there are these risk factors and LDL cholesterols that come in, and to be mindful of that. And what your take is on maybe the common things you give out to people, and Tara, you too, because you guys see a ton of these people just for these types of visits. So we want to let all the listeners know without having to come all the way out to Rochester, Minnesota, and to see one of you guys in person.
Why do we use so much like shredded mild cheddar from a bag, Chef Jen? Right?
I
Like,
love
does that just like
charcuterie.
that just like boils
Question.
your blood?
You know what I think is funny? This is usually how I explain cheese to people. Like, imagine if you went to a cocktail party, right? You had mild cheddar cubes and you had like feta cheese balls. You are not going to take like 6 feta cheese balls. You'll take 1 or 2. You will take 6 or more mild cheddar cubes easily. And why? Because they're mild, right? So, with that concept, it makes me think, okay, so a little goes a long way. So in my cooking, if I'm making like a pizza, even if it's a healthier pizza, can't I just kind of put a little bit of like mozzarella, right? Because we're not trying to like take it away, but can we add a really good Parmesan? Can we add a really good a feta cheese? Even maybe you want to do gorgonzola, you want to do Gruyere, something that's really got some punch to it. So we're satisfied with less. So I think that's a huge part to this. And sometimes people say, well, some of these things are more expensive. You're right. They are, but they're better quality and you'll use less so it'll last longer, right? Because cheese theoretically does last quite a while. We just have to be intentional about using it in more of our recipes. If you think about it, people put cheddar on everything. Why can't we put Gruyere on everything? Right. So when you're doing like lasagnas, when you're doing some of these casserole dishes that we're so used to, right? Can we not switch that up and use an extra shrimp cheddar? Do a smoked cheddar, right? Something that's got a lot of flavor.
Right. And this can actually have an impact on people's calorie intake. So the examples that I use are cheese, number one, chocolate, right? Like how much milk chocolate could you eat? Or let's talk oil, right? People kind of complain about the cost of like very nice olive oil, but if you're dipping bread into it, that there's a big difference there. So there really is this like mathematical exchange of if something is that much stronger, you're going to have less of it, which means you're going to save money because you're not going to use it up as fast, and you're probably going to have less calories, and it's worth it. Like you can really, really enjoy even the few bites that you have.
I love that. And I mean, we're getting close to running out of time. There's one more question that I'm dying to hear because I get asked this question sometimes at some of these CME talks is what about a post workout? What are protein shakes? And a lot of it, these dairy high ultra filtered types of shakes that have a lot of protein in them. Is this a good form of getting our protein in? Are they healthy for us? Are they considered ultra processed?
So I keep it really simple. I think cottage cheese is amazing, right? And I usually do like a medium. You can do low fat cottage cheese or 2%. The other thing I think is really powerful is instead of like buying these protein shakes, making your own using like a non-fat plain Greek yogurt, throwing some frozen fruit and maybe some raw oats because we're going to get and not a lot, right? We're not trying to throw in a ton of oats, where that would be almost like your pre-workout. But what we're looking at is really just having something that can kind of fill me up and it's doing all of the right things. But here's the thing. I can make a blender full of that and put it in little mason jars. I also explain to people, set your environment up so it's easy for you to make really quick decisions and it's easy. So get the small mason jars, scoop all your yogurt in there. If you want to throw some berries on there, great. Maybe you portion out a bunch of your cottage cheeses because we are in a society if we want things that are very efficient, right? And we don't want to mess with it. We want it already done. It's all convenient. So if you set your environment up so it makes it easy for you to do it, so maybe you do it on Saturday or Sunday, right? And then on Thursday, you have to do a few more. That is okay. But I think if you can look at those, typically things like cheese sticks are okay. They don't necessarily do the job. So typically I kind of resort to that. One thing I wanted to mention that I didn't get to mention before with cottage cheese, this is awesome. it's in my cookbook, a cilantro lime dressing. It is pureed cottage cheese. It gets very smooth.
Yeah.
There's cilantro, lime juice, garlic, a little bit of olive oil, salt, pepper, right? What's amazing about it is it works great as a sour cream, works great as a dip, it works great as a spread. So it can make eating your broccoli a little bit more entertaining. Plus, I'm getting that protein from the cottage cheese versus it being a sour cream based dip.
Do you have a replacement for those of us who don't like the taste of cottage cheese? I've tried to like it and I cannot
It's very
stomach
trendy
cottage
right now.
cheese. I know, and
Oh.
I'm not the trendiest, I guess, because I can't stomach it.
What I'm kind of wondering though, is that a texture thing for you?
Maybe. Maybe I should try to put in my Vitamix and try that recipe you just mentioned. Maybe I'll give it another try. I tried it in college a few times based on the South Beach diet. That's a low carb kind of different phases. And cottage cheese was one of the main characters for most meals every day. And I just couldn't do it. I just could not. So maybe, but I had it in the curdy like way.
Yeah.
And I'm not from the Midwest, so I don't love like those types of
Yeah.
textures.
What I have noticed, because we do this for every CME, this is the class that they do, and that's the recipe they make. And even in other ones, when I put it out on the salad bar, they're like, "What is this? This is sour cream." I'm like, "No, it's cottage cheese." They're like, "There's no way. I hate cottage cheese." And I'm
Okay.
like, "No, I
That's Chef Jen's.
All
you
right. So
gotta
smooth
find ways."
cottage cheese coming up. Well, ladies, I am so thankful that you took time out of your busy schedules to join me in a really fun discussion about the effect of dairy and heart health and some kind of easy, practical ways, and maybe some questions that people have had that I've looked on the internet. And you guys, both in your respective positions, have a lot of experience out there. And so, I just feel honored to share this platform with you to talk about it because I think people really want to find sources with people who actually study this as part of their training and live it every day versus picking it up because it's trendy. And I do value both of your opinions and expertise. So thank you so much again. And I can't wait to collaborate again in the future.
Thanks for having us.
Thanks for having us.
Thank you for joining us today. We invite you to share your thoughts and suggestions about the podcast by emailing cvselfstudy@mayo.edu and find more episodes at cveducation.mayo.edu. Be sure to tune in to each episode and tune in each week to explore today's most pressing cardiology topics with your colleagues at Mayo Clinic.